So, am I really in recovery from cocaine and speed addiction? Stick around and we'll try to sort this out together. Hey kids, straight talking Fedora Chic coming at you today, and welcome to the channel. If you're new here, we are a social commentary story time channel where we focus mainly on mental health issues, but not exclusively to social issues of the day. If you're into that kind of thing, please consider subscribing and please hit that little ringy dingy icon below so you can be notified every time I upload. This video is in response, at least in part, to, according to Jexi's upload from yesterday, as to why addicts don't say sober. And it's a word that perhaps needs to be redefined. Better minds than mine to answer that. But yes, Jexi yesterday in her video basically reminded us that the word sober pertains pretty much exclusively to alcohol. There are drug addicts or those in recovery who never ever had an issue with alcohol, and yours truly happens to be one of them. I just wanted to say that I am really happy that she covered this, because to date, honestly, I haven't heard much talk about that. Nor have I really seen it, unless, of course, it's pertaining to medically assisted recovery or from those who must take controlled substances to get through life. For example, someone who may be in recovery may have ADHD and they must take a drug like Adderall to walk through life, to be functional. Or someone who suffers from such severe anxiety that they must take something like Xanax to get through the day. However, not too much talk about, say, someone like yours truly, as mentioned, who is offered poisons of choice. Yes, boys and girls, I am still off cocaine and speed for the past 20 years now. But I still may have the occasional drink with a friend on a special occasion, or even cook with alcohol. In fact, if anybody follows me on STFC Kitchen Mishaps, which is a food channel I haven't uploaded to in a few months, there are 3 cooking shows, and all of them involved alcohol to some degree or another. Plus, there had been talk with one of my doctors regarding medical marijuana for my migraines and my anxiety, which have been resistant to traditional medical treatments. Still don't have that prescription, for the record, and I think that is likely more due to my early onset FTD. But anyhow, yes, there are people who pill shame those who are either on medically assisted recovery. The debate of whether or not they are really... I will use this word to describe being off drugs in this video for the sake of this discussion. Everybody seems to have an opinion, and what gets me is that people who have never been through addiction are quick to put labels on everything, to be judgmental. Personally, I think this causes more harm and stigmatization than good. Most seem to think that a true recovery is abstinence from all substances, full stop. And I'm here to tell you that, in my humble opinion, no, it is not, and nor should it be. For example, maybe now a recovering addict may be abstinent from all controlled substances, but later down the road, we never know what can happen. For example, they may have to go through surgery, or they may come to have some injury or illness that puts them in so much pain that maybe some medication might be required. Or they might have an anxiety disorder so debilitating that they cannot get through their day without a prescription medication like Xanax or Ativan. Or someone with a health condition where traditional medicine has failed them and might entertain medically assisted marijuana. As for yours truly, last year, as many of you might know who have been here before, I had to have my remaining upper teeth removed after they broke on me. I was given a prescription for Percocet, as Tylenol would not have worked for that kind of pain. especially within those first 48 hours. I used it responsibly and took only according to the prescription. And I only took them only within the first 24 hours, which afterward Tylenol became sufficient. Trust me, having upper front teeth removed is a longer and more difficult recovery process. But not every recovering addict would be able to handle a prescription for something like Percocet or some other stronger narcotic for pain relief. What is the solution for those people? That is for better minds than myself to understand. My point is, we should not be judgmental towards others. We should not be pill shaming. And what happens and what somebody might take, whether it's a recovering addict or not, is between a healthcare professional and the patient themselves. For those who are on medically assisted treatment, like something from heroin or any other opioid addiction, they may require maintenance drugs like Suboxone or methadone. As an outsider looking in, I find this population is most heavily stigmatized, and it goes to pill shaming, as many do with those mental illnesses who do take medication to help them function to walk through the day. For those on Suboxone and methadone, it has greatly improved their lives. If not for such maintenance drugs, many addicts would not be able to even dream of a normal life, such as holding down a job, raising a family, etc., etc. It also goes without saying that more would relapse if not for those maintenance drugs, even after the detox phase was done. As for Jexi's video from yesterday, where she spoke more specifically about those who are off of drugs but may continue to consume alcohol, can we consider these people drug-free, clean? The short answer is, I think it depends on the addict. It goes to the argument that there is no cookie-cutter solution for all addicts, which makes addiction so complex. If an addict had issues with alcohol, with whatever drugs they were taking, then yeah, perhaps it's not a good idea to continue drinking at all. Even if someone didn't really have an alcohol problem with their addiction, it may be not such a great idea if they were at risk for that one drink to become some kind of gateway for a relapse into the drugs they were addicted to in the first place. It also should be noted that many addicts find another addiction to replace whatever they were addicted to. For example, a heroin addict can turn to alcohol. A meth addict can turn to painkillers. Then, of course, no, I think we can all agree that this is not recovery from addiction. It is merely substituting one addiction for another. That sadly occurs more often than not. Now, as for myself, I know that one or two drinks that I nurse slowly when I am out with friends or friend on a special occasion will not set me off. Personally, I don't like being drunk, so I make sure I don't get that way. Since I don't have too many friends in my immediate environment to begin with, I am often left alone at holidays and other special occasions anyway, so that means I don't drink often. It happens maybe every 3 to 6 months, and I never drink alone. Just to give you an idea of how infrequently this happens around here for myself. So, if we're to slap a label on people like myself who have really been clean for the past 20 years, I guess that depends on who you ask. Myself, I do consider myself 20 years clean, as cocaine and speed were most problematic for me, and I have not touched them in all that time. But I am also cognizant of the fact that many would disagree with me on that score. That used to put me on the defensive, and frankly, I found it harmful. But ultimately, it is my decision now how I go about my life, as it is for any addict with their own recovery. And anybody in recovery right now who might be struggling or thinking about going into recovery, my best advice is for you to first consult with a healthcare professional and start off from there. I am only talking about my opinion and my way of doing things. It may not be right for a lot of people. At the end of the day, what would really help people in addiction recovery, as with mental illness, or someone who is non-neurotypical, such as somebody who is on the spectrum, is to stop slapping labels on us and stop telling us what they think is best for us. It only further perpetuates the stigma of addiction, mental health. As we all know, this, more often than not, makes matters worse and causes more harm than good. That's going to do it for this video. Please give it a like on the way out the door if you like this video. Please consider subscribing and hit that little ringy-dingy icon below so you can be notified every time I upload. Please take care of yourselves and each other. And remember, if there is somebody in your midst who is vulnerable or at risk, please take the time to look in on them. Maybe share a meal, share a coffee, or just lend a sympathetic ear, because sometimes those simple gestures can make all the difference in the world to that person. And I'll see you in the next one. Straight talking Fedora Chic over and out.